The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar topic today is Navigating Your Role as a Brain Tumor Caregiver. Thank you to today's webinar sponsor, Genentech, for their support of this program. My name is Umbreen Maan, Program Manager here at the ABTA, and I'm delighted to introduce our speaker. Dr. Amy Clara is a clinical health psychologist at the Center for Psychiatric Oncology and Behavioral Sciences at the Massachusetts General Hospital Cancer Center. She is responsible for patients receiving cancer care, supporting family and spouses of patients going through cancer care, and is involved in a variety of ongoing psychosocial research projects. She is also committed to collecting oncology resources and referral information so that the patients and their families are connected with as many support services as possible. Thank you so much for joining us, Dr. Clara. You may now begin your presentation.
Great, thank you so much for that lovely introduction. Hello, everyone, to those who are here live and those in the recording. So I'm just going to go ahead and get started. So as Ambreen said, there will be time for questions at the end. Again, just put them in the Q&A section. And then for anyone who is a note taker, please know that the slides information will be sent out after the presentation is complete. I have no financial disclosures or otherwise conflicts of interest, and I am currently employed at MGH in Boston in the Center for Psychiatric Oncology and Behavioral Sciences in the MGH Cancer Center. All right, so today, next about like 45 minutes, we're going to be going through some learning objectives. So one thing is I wanted to help recognize the different roles that caregivers take on. And also understanding how to prioritize and ask for help as a caregiver when help is needed, either for yourself or for your loved one. And the other, kind of third piece, final piece, which is kind of an ongoing project I think all of us are going through, but I put a bunch of resources at the end. And I believe Ambreen will also be sending out with the finalized presentation recording, is identifying resources that are currently available to help you manage your role as a caregiver. All right. So first up, I just wanted to just put out, what caregiving can be. And I just want to say that not everyone loves the title caregiver. I am going to use it in today's talk, but just know that it's okay if you don't love the name caregiver or caretaker, that's okay. You don't need the label to be in this role with a loved one. This is the picture of Charles Darwin's finches. And for those who know the story, the adaptation of the finch is that depending on the environment, the finches evolved into their different categories of needs. So how they adapt to their environment, their food needs, their mating needs. Darwin saw this as an adaptation. And I have always felt that as a caregiver, because you're not, you don't wake up one day and you're a caregiver. It's a role that you're either given, you choose, or sometimes you're just a part of before you even know it. So this first part, again, the acquiring aspect is, how did you become a caregiver? And I like to ask this of the patient's families, spouses, friends, caregivers, and other sections, just because how did you become a caregiver? And for many of us, we say, oh, I chose this role. Sometimes though, the role chooses you because either you're a parent or you're a spouse who said, I'm going to be with this loved one through thick and thin, and this is where I am. But the actual training of becoming a caregiver does not come naturally. So most people acquire these skills along the way. The two other pieces is adjusting. So as many of you probably know or are about to know, that with the role of a caregiver, you have to start to adjust to the differences. And this can both be as you're taking care of your loved one, but also different needs that might pop up that are unexpected. So you have to be a little bit more flexible. Did the schedule change? Do we need different information? Do we need a second opinion? What do we need and how do we adjust to that? And then the adaptation part, I really put in here specifically for the caregiver, because there are a lot of things about your life that may or have already changed. As a psychologist, I know I see a lot of caregivers change in how they take care of themselves. That's something I'm going to go into in a little bit. But also the emotions that come up. A lot of caregivers I've talked to and taken care of have talked about how they're experiencing guilt and they're experiencing frustration, angst, resentment, a lot of sadness for a lot of people. And especially if the relationship you've had with your loved one had a particular spot in your life, but that your role as a caregiver changes that relationship, there's a little bit of, again, that adaptation, that adjustment to this new role in that relationship that can come with a sense of loss for many people. So again, as you're thinking about how am I a caregiver, how did I get here, thinking about how did I become the caregiver, what adjustments am I constantly making or have I had to make in the past? And then as things are moving forward, how do I adapt? And how do I adapt in a way that is both productive but also manageable for me and my loved one long term? All right, so I wanted to kind of just put out there what kind of support are we given? And so when we're talking about, coping strategies and thinking about support, I want to categorize this into two different sections. One is what do we give as caregivers, and one is what do we take? So with the what to give, I like to categorize this into two different columns almost, one being action oriented, talking about what are things that I can do. And a lot of people like to be in this space because it feels like you're doing something active. There's something that you can look at on a piece of paper and do a check mark and say, I've done this, I've taken this action, this is how I take care of my person. So one piece is information seeking. For those of you who are involved in your loved one's medical appointments, there's medical prognosis, so having the conversation with the clinical team, expectations both of treatment, but also about quality of life. How do I expect my loved one to live right now with what's going on with them? And it can be small changes or big changes. And then treatment options. Again, a big conversation or a small conversation with the clinical team of, and again, like you might be involved for the entire conversation, and some loved ones are only comfortable with you being a part of a small piece of that conversation. But as the caregiver, one of those action pieces that you can be is a lot of people find comfort in, what can I what can I look for online? What other treatments are there available? Are there research studies going on that we might want to enroll my loved one in a trial? So again, all of these are actions that caregivers can take that oftentimes make them feel effective and as if they are doing something helpful. The other piece, and I'm sure most of you who have already, been a part of this world, is the organization factor. So there's medical organization, physical organization, financial, and scheduling. So talking about the medical piece, different people address this differently. Some people will say, is it okay with my loved one if I have access to their medical chart? For those of you who have electronic health records, can I help transport my loved one? So can I be a driver or can I help set up, a ride or an Uber or navigate how to help someone else take my loved one to the hospital or to the clinic? Financially, are there things that we need to talk about in terms of how to prepare for needs or to acquire certain resources that might take some extra financial, resources that might not have been thought of before? And then again, I'm sure everyone's very familiar with scheduling and for the many appointments that come up, and these can be again the small appointments, getting the labs done, to the big appointments, getting the MRI done, and then the follow-up appointment with the clinical team. So again, action oriented, this is just one type of support that we give. Again, most caregivers feel like they're being effective when they're doing an action. But at one point, there's a time where most of us, there's nothing else to do. There's no other action to take, but we still sit with this discomfort in our bodies, discomfort in our minds of what else more can I do? That's where we kind of move over and shift over to the emotion-oriented support that we offer our loved ones. So again, this is a list. It does not need to be a final list. There are, of course, more things to be added to this, but what I have seen in my work with caregivers, spouses, family members, loved ones, reassurance, validation, listening, anticipating, and again, the non-judgment, non-reaction piece, I put that at the end because for those of us who know, when you're working with someone or you're taking care of someone, there are these parts that are incredibly frustrating, and you want to be very careful with if someone's asking for support, but you're like, I'm doing my best, I'm showing up, I can't give any more, and the person that you love is saying, I need your help with this or I need your support in this. Don't judge them for asking for that. Try not to have a reaction in that moment. You can notice it and take care of yourself and say, let's try to find a way to get to that need. It's okay if you say no, though. So again, these are just parts of us that we give. And the idea is that when we give the emotion-oriented piece, these are the not as tangible, not as action-oriented parts of this, but it does help us feel like we're taking care of the mental and psychiatric and the emotional part of us, i.e. the soul that lives inside of every one of our bodies. And then the support that we take. So again, this is as a caregivers, what do we need for ourselves to be the best caregiver? In the action-oriented column, information seeking. So looking at what is my role as a caregiver? And for those of you who showed up today or are watching this as a recording, this is one of those tasks that you can say, this is me doing part of my job, is part of my homework, is I'm seeing what is the role of a caregiver. Because as I said before, when you become a caregiver, it doesn't, it's not necessarily a natural process. we're already in the relationship with the person we take care of. And so as we evolve into it, we're trying to figure out, what am I supposed to be doing? What are the expectations? What are other people doing? What are other caregivers doing in their role? And how have they managed the more frustrating, more challenging parts of caregiving? And then I just put the use Dr. Google sparingly, because even though researching can be a really nice way to help us kind of have an idea of what we need to do to take care of our loved ones, Dr. Google, and I'm sure maybe if you have run up against this, is full of just a lot of misinformation or information that's going to be very scary, and it's actually not productive and sometimes counterproductive to being a caregiver. And so every time you reach for, your smartphone, or you're going online to Google something, I'm just giving you kind of a kind word of caution. Be careful with it. Hold information lightly when you can. If you have the access to them, go to your loved one's care team and say, I heard about this or I read about this. Is this, in my loved one situation, is this relevant to us? So again, try not to go too far down the rabbit hole, just because Google can really hold a lot of anxiety-inducing information. Again, discussion with the clinical team, and then identifying support groups. So I know in Boston we have resources for caregivers. We don't actually have a caregivers clinic yet, but we do take care of people through our wonderful social work program. We have support groups. We have a research trial going on for our caregivers here. So wherever you are and wherever you're looking for resources, looking around for caregiver specific support groups, because very few people know what your experiences is other than other caregivers. So again, just a gentle recommendation to look for that for yourself specifically. Sometimes these support groups include the person that you're taking care of, and sometimes it's just for the caregiver. And then on the other side, the emotion oriented, if you notice something similar about the last slide, is that it's the exact same thing, because we are all people. We all have the same emotional needs inside of us. What your loved one might have needed for their emotion oriented support that you were giving them, you also, as the caregiver, because you are also a person in this world, you need very similar things in terms of support. So again, reassurance, validation, listening, anticipation. Some people will say, well, no one's going to know what I'm going through. And partly that is true, right? So either you seek out a similar caregiver, or you seek generalized listening, generalized validation, be it from a close friend, from a neighbor, from a community member, from a faith leader, who can maybe just give you, again, this gentle aspect of looking at you and saying, this is incredibly tough what you're going through. I can't imagine how you're getting through this. What can I do to support you? So you may need to seek this out. A lot of people outside of the caregiving and outside of the patient roles, they might feel uncomfortable knowing how to reassure you, how to offer you validation. So it's okay to tell them and say, I just need you to tell me that it's going to be okay. I'm in a really bad spot right now. I'm really frustrated, or everything feels like it's falling apart. I need you just to give me reassurance, or tell me that I'm doing a good job, or tell me that you're here for me when I need you, even if you can't change things. So just my point to make here is that it's okay to ask for these things, even if you're not the quote unquote identified patient who's going through treatment. You are also being affected by the same situation. You are also in the ripple effect of the diagnosis in the middle. You need support as well. Maybe you're not getting it from your loved one, and maybe that person used to be your rock. So maybe you might have to shift and look for someone else. That's okay, though. That's incredibly normal, and most successful caregivers will seek support outside of that loved one. And I just want to put in here again, just some signs of, what happens when you might not be doing well. And I see this a lot in caregivers who they push and they push and they push and they say, I just got to keep going. I have to stay strong for my person. And it's the answer is yes, you do need to keep going. And many of you feel, I've heard people say a lot, I feel like I have no choice. What other choice do I have other than take care of my loved one? I love them. I want to take care of them. I want to be there for them. That is an of course situation. If you care about this person and you were in this caregiving role and you were committed to being the caregiver, of course you're going to be there. With that being said, it does not mean that you need to sacrifice all of yourself, and that includes your mental well-being, your physical well-being, sometimes your spiritual well-being, just to be a good caregiver. So these are just some signs that we do see. Again, this list is non-exhaustive. There are other things that we might pick up on of a caregiver that we might say, like, I'd like to reach out to this caregiver and offer them some more support. But these are just the common signs that I see in my role as a psychologist in the cancer center, working with patients, working with families, working with support groups. These are when we start to say this person might need some extra support. So one is excessive reassurance seeking. So this is asking the same question over and over and over again. The caregiver is saying, "Will they be okay? How long do they have? What's the prognosis mean now?" Asking the same question over and over again, and maybe getting the same answer and feeling like this is not good enough. Even though that feeling is absolutely valid, if you're going online, if you're seeking a second, third, fourth, backup um, referral knowledge, it's gonna be too much. It's probably not giving you anything back productive. So if you notice that you're getting caught in excessive reassurance seeking where you're asking the same thing over and over again, you're getting the same response, but you're still going, looking at that behavior of what are you really looking for? For most people, it's a sign of anxiety in the sense of I'm anxious that what we have available to us is not enough. And again, incredibly valid to feel that way. However, doing the excessive reassurance seeking is usually distracting us from taking care of ourselves in a different way. So just keeping an eye on that. Another thing we see commonly is avoiding people, places, or activities that usually help you feel balanced. So sometimes we'll see caregivers say, like I can't go out to dinner with my friends because I can't leave my person at home alone. And this person says, "Oh, I haven't seen my friends in 6 months," and while yes, the friends may not understand what you're going through, it might be a good just expression of like going out there, being with people who know you, people who care about you, and that yes, maybe you need to find someone to take care of your loved one if you feel uncomfortable with them being alone or if they really cannot be alone. It's okay to ask for help or someone to sit with your loved one while you go out with friends. It is not a bad thing. In fact, we would say we encourage that for people to take care of themselves by still engaging in any of these activities that are good for self-care. Again, if you notice that you're like, oh, I can't go back to the gym because if I go to the gym, someone's going to ask me about what's going on with my loved one. I'm not going to know what to say. Again, incredibly valid thing to think. However, if going to the gym is part of your self-care, it's really important not to avoid that. If you're struggling with how do I explain my situation to people who do not understand, it's a very quick and simple. I don't really want to talk about that right now, but thank you so much for asking. I can tell that you care about me and my loved one. It's okay to redirect. It's okay to, shift and just go somewhere different and say, I don't want to talk about that right now. Absolutely appropriate. I've heard a lot of people say that feels rude. I'm giving you permission to say that in a way that's kind, gentle, but also a firm boundary. And then also activities. I've had a lot of people who have stopped doing enjoyable activities because they feel guilty that their loved one can no longer participate. I, of course, will never speak for patients, but oftentimes, if they knew that you were giving up on something that really brought you joy and pleasure, that was not sacrificing anything otherwise, but that you were avoiding it for the sake of them, many people would say, "I sure do wish that my mom or my wife would go do that thing, even though I can't do it with her. I want her to feel good. I want them to feel happy. I want them to still engage in a life that's, that makes them feel okay sometimes." And then the third bullet, excessive or frequent worrying, especially if it feels out of control. So I know that word excessive is a little bit subjective, but if we're talking about you wake up worrying, you worry through breakfast, you worry throughout the day, you're sleeping poorly, things like that. If you're noticing that worry is getting in the way of any of your normal functioning, and again, we're talking eating, sleeping, going to work or school, taking care of your own hygiene needs, taking care of your own medical needs. If you're skipping this because you're worried, or you're worried that you need to be with your loved one all the time for them to be okay, or that you're going to miss something really important if you go do an hour of something else, that's another sign to go talk to someone. And again, this can be anxiety, this can be something else, but this would definitely be an area of time where you would really want to go seek out extra support. And then the fourth bullet point, struggling to make time for yourself. This is a big one because with a lot of caregivers, especially going back to that first slide of adjusting and adapting, is scheduling, right? So if you're taking care of someone and they have even 3, 4 additional appointments a week, that's going to take up a lot of time in terms of navigating your schedule, navigating rides, navigating the clinic or the hospital that you're going to. People say, how do I fit in any time for myself? And we're not suggesting that anyone goes right back to their schedule before they became a caregiver, but starting very, very small, that's a good place to start. In the busy week where you're trying to navigate your life, your loved one's life, and sometimes other people's lives, because some of us have multiple caregiving roles as parents, spouses, even our work can be a caregiving role. It can feel overwhelming to find even 15 minutes to yourself. The purpose is to start doing it early, small increments, and do it consistently, even if that looks like every Monday for 15 minutes, I listen to my favorite podcast. Or on Wednesdays for lunch, I go to Starbucks and get myself a nice cup of coffee, not the coffee in like, the regular office workspace. So little tiny things, and even though these sound like very small, like what's the point? How's it gonna matter? Having some semblance of control over a small part of your life to give back to yourself is incredibly important. And then again, just signs that you might need to take a break or like kind of refresh and come back to this piece. I bet your common examples will see people who they themselves as caregivers, they're constantly getting sick. It's cold after flu after cold, and they're not getting better. They're not sleeping well. A lot of people will have like almost like an unusual clumsiness or like forgetfulness. They feel like they're just so overwhelmed. It's almost like a fog going on upstairs. People will trip more often. And they're like, wow, I was never clumsy before, but it's because you're spending so much time thinking or worrying or being so consumed with the caregiving role tasks that you're not as aware of your surroundings, you're not as aware of your body. So just keep an eye on your behaviors, on what your brain is up to, how you're thinking. And if you are concerned or if it's getting in the way of your functioning, ask for help. And sorry, the last piece here is the increase in maladaptive coping mechanisms. So this would be something that you might do to mitigate discomfort. Overuse of alcohol is a pretty common one, or overuse of substances. Sometimes we see people who just shut down completely. They'll isolate themselves away from other people. Anything that like maybe in the moment feels okay to use, but long term is not a good solution for your distress, have that be a red flag that says, I'm not doing okay. I either need to take care of myself differently or I need to ask for help here. And then the last but not least, this is again, these are just like common thoughts we hear of a lot of caregivers, especially those who've loved them to have brain tumors, is that, not knowing how to support your loved one. Brain tumors are especially, it's a unique part of the oncology world because there's a lot of unknown still. The treatments can be pretty significant, and so there's a lot of unknown. There's a lot of wait and see. Let's go to that next scan. And there can be some pretty scary side effects for some of these treatments, and not knowing how to take care of your loved one when they are suffering or when you perceive them to be suffering can feel very helpless and for some people hopeless. So that sense of I'm not doing well, I'm not being a good caregiver, there's that guilt that can be piled on there. This is incredibly common. And also, if you feel like this is getting in your way of functioning most days, that's a time to say, red flag, I need to access help. I need to go out and talk to someone else about supporting me, or how can I change the situation so that I can feel differently about this. I hope it all made sense. Again, happy to answer questions or clarify after the talk through questions, or again, contact later. Happy to answer questions. All right, so if I could see any of your faces, I would ask, who has heard of the Caregiver's Creed? So I actually could not find where this originated, but I became familiar with this when I used to work with folks who had Alzheimer's and Parkinson's. And the idea is that you really have to be thoughtful about your role as a caregiver if we're talking about taking care of yourself in the caregiver role. And so the Caregiver's Creed, this is a short list, kind of like the abbreviated list, or a little bit more poetic, list out there. But these are really 10 qualities that we really ask caregivers to think about and reflect on. So just as you're trying to go through, does this caregiver's creed apply to me? I want you to go through this list either now or later after the talk and ask yourself, most days, do I take care of myself, accept that caregiving includes the full spectrum of emotions and these are valid and normal? Do I ask for help and accept it willingly? Do I seek information that will empower me? Do I respect the preferences of my loved one? Do I accept the change that is a natural part of caregiving? Do I celebrate the small successes and allow myself to grieve the disappointments? Do I stay mindful of my needs and guard my rights as a caregiver? Do I forgive myself my shortcomings? And do I congratulate myself for the effort and love I put into caregiving? So it might seem like a big ask for all these to happen at once. So I just want to say no pressure. It's really about just when you can think about these 10 components of caregiving and saying, where am I on the scale? Where am I on taking care of these different parts of myself in this role as a caregiver? And if you notice one that is especially challenging for you, that can be something to work on, either with yourself or talking to a friend, talking to a counselor. These are just components that we say caregivers who do well in terms of taking care of themselves and their loved one take this list into consideration and really challenge themselves to, as much as they can, meet these most days. Again, we all have bad days. We all have moments where we are extra vulnerable, we are tired, we are cranky, and we are not the kindest person to ourselves. That's also very normal. When you notice that you're having those days, you can say, all right, let's come right back. Let's go back to the caregivers created and check back in with myself. Oh, so I put little red circles throughout the rest of this talk just because sometimes, and I'm not sure if anyone has this experience, but when someone is talking at you and throwing a bunch of information at you, it can sometimes be hard to kind of sort through all the information and say, all right, what's the most poignant? What's the most important for me to remember? What's the takeaway here? So on this particular slide, what I have seen the most as a big struggle for most of my caregivers who I work with is that they really struggle to forgive themselves for when they're not perfect. And I don't know where this idea of perfectionism comes from. For all of us, it comes from different places. But for caregivers, I suspect it comes from a place of deep love, where the idea is that I want to be everything for my person. I want to take care of them to the best of my abilities. And of course, because all of us are flawed, we're going to fail sometimes. Sometimes you're going to forget an appointment. Sometimes you're going to be late to an appointment. Sometimes you're going to forget, which med is at which pharmacy, right? It's okay. Your job is to be the best that you can be, but the best comes with flaws, it comes with failures, it comes with mistakes. Your job is to forgive yourself when these shortcomings come up, because only from shortcomings can we learn to be okay the next time. Okay. Of course, if other ones of these speak to you, no judgment, feel free, but that's just what I've noticed with a lot of the caregivers that I've worked with in the past. All right. So a little bit more, some more practical tips. I have a couple of slides on management. So going back to the action-oriented skills that you might do as a caregiver, getting organized is a huge, huge, huge piece of this. Part of it is just to decrease the sense of being overwhelmed. So there can be so much information given to you. There can be so much in terms of going to appointments, receiving information, conversations with the clinical team, conversations with the pharmacy. There's so much that can be going on in terms of treatment, navigating side effects, navigating next steps, conversations about what's coming up soon. Get organized as soon as you can. It will save you time. It will save you distress. It will help everyone be on the same page. Paperwork is a really big one. I think a lot of people I've noticed they put paperwork off, and that can be either for their loved one or for themselves. I'm thinking in particular about work paperwork, but there can also be things that are a little bit more legal paperwork that might need to be taken care of. Getting it done, and I think a lot of people have some superstition around getting certain paperwork done early. The earlier you have it done, the less you have to worry about or the less you have to think about as time progresses. So gentle recommendation, get the things that you can get done early, get yourself organized, have some semblance of like how you like your tasks to be done for different things. Early and soon is easier for everyone. A big recommendation I have for any of you who share caregiving roles, because even if we're a primary caregiver, sometimes a family has multiple caregivers, or we have a community member or a neighbor or even someone who is from a fund will help out with a loved one's care. Get onto a shared calendar. That can be a Google Calendar. Actually, I think I have some apps in the next slide I'll share with you. It can really help, again, to organize everyone, keep everyone on the same page without having to do constant reminders, follow-up emails, follow-up text messages. Getting on the same page with a physical item, physical calendar can be really important for a lot of people. It also takes the burden off the primary caregiver from having to answer the same question multiple times to multiple people. And then going back to the self-care piece, making sure that you're scheduling time away from your role as a caregiver. A lot of people who will just throw themselves into this identity, like this is what I'm doing, this is where we are right now, it's really important to me, which is a yes, of course, but also not losing yourself in the caregiver role. A lot of people, again, everyone's time frame is very different. Some people are caregivers for years, sometimes people are caregivers for months, weeks. It is vastly different depending on the situation, but making sure that you do give some sense to your other identities, the other parts of you, maybe your parenthood or your career, or even your love of bird watching, right? Making sure that you're giving parts of yourself a little bit of attention so that you're not getting fully lost in the caregiver role. And this piece has really been given as advice from caregivers after they have left the caregiving role, and they say, wow, I really wish I had kept up on fill in the blank, because now that my caregiving role is complete, or it's no longer the biggest part of my life, I don't have a lot to fall back on. So just keeping that in mind of as you are falling into the caregiver role, what other parts of you might be taking a break or might be being sacrificed. It's okay if they are temporarily, but just making sure you're giving some time and scheduling, again, those 15 minutes on a Monday to do one thing that gives back to those other parts of you. Identifying a backup caregiver, this can be tough, but for those of you who are lucky to have multiple caregivers in a family, that's one piece of this. It can also be training someone, it can also be asking in someone who does respite care. There are multiple ways to find a backup caregiver depending on what your loved one needs. Sometimes they don't need anyone, they don't need a babysitter, for example, but it might make you feel better if someone just came and sat with your loved one, even if you know it's just, their best friend comes over while you go out and do the grocery shopping, for example. There are multiple ways to have a backup caregiver, but it really does help to get organized, have that person or persons identified before the need comes up. Practicing open and direct communication with your loved one. This again, there's some tricky stuff here, right? Where you might have feelings about your experience, but you don't want to burden them because they're already going through so much, which is again an incredibly valid thing. And honestly, it's a very caring, loving thing to think and to try to protect your loved one. But we have heard just from our caregivers that are here at MGH and other people I've worked with in the past, the more that you can have that open, direct communication, the less of this like guessing game, walking on eggshells, trying to guess other people's feelings. That can really bog down and negatively affect a person's relationship with the person they're taking care of. So the more that you can be open and honest and use those I feel statements that many of us learned in kindergarten, the better that your communication is going to be in the long term. If you feel like you need to protect, your loved one's feelings for a certain reason, maybe run that by someone else who you trust and you trust their opinion, you trust their response, and they can kind of give you some feedback. I suspect though that most people, especially the loved one, would really want to know, what are you feeling? How are you taking care of yourself? What's going on with you in this situation? Because most of us have a bi-directional loving relationship with the person we're taking care of. That being said, I know that not everyone has, a fully open relationship with the person they take care of. That's okay. Sometimes love is complicated, right? But caregivers are delivering care. And so in that relationship, open and direct communication is really important. And then last but not least, identifying support resources. Again, for those of you who are showing up or listening to this, hopefully this is one area where you can grab some resources, grab some tips and tricks, and carry these forward with you. All right, so just some app recommendations. These are ones I've used all of these myself personally, and I've also worked with my patients and my caregivers and my families using all of these. With that being said, because I'm not like invested in any of these companies, you are welcome to take these take this information or leave it. Okay. So the three top shared calendar apps and devices that a lot of my patients use with their families just to keep everything nice and organized. Number one is Google Calendar. You do need to have a Google Calendar, like a Google account. I know people have feelings about Google, it's fine. It's just an easy one that you can really share multiple calendars across the board. It's colorful, it can be very minimalistic if you need it to be. It can also share tasks that if you might want to have tasks done. That's one of them. Cozy is actually the one that most of my patients use. So this is interesting because it looks cute, it's kind of clean, it's kind of nice, but you can also assign tasks. So if we're talking about sharing the caregiving role, say that you might be the caregiver who does all the rides, but there's a secondary caregiver who does all the scheduling. You can assign tasks, you can assign every person a color, a little bubble, and that person can see it. But also your loved one, if they want to know what's going on, if they want to know how people are taking care of them, they can also be included in this app. So this has been a little bit more of like seeking transparency around caregiving for a lot of people. And I think this just helps people feel more efficacious in how am I participating in my care and how am I participating as a caregiver. Again, this is not a huge endorsement, but this is just something that I know people I've worked with have found very successful and very helpful. And then Flake or Flack, I'm not sure how to pronounce that. This is something that's been more recently brought to my attention. A couple of my families use this. This is, again, you can assign tasks, you can add pictures in here. It's a little bit more, I find it a little bit more, not complicated, but details. If you're someone who really loves detail oriented, if you're detail oriented, that's a really nice app. Again, not an endorsement, but these are just ones that my families and my patients use. And then specifically for self-care, so talking about those 15 minutes on Monday, what are you going to do with those 15 minutes? A really strong recommendation I'm going to give everyone here is to make sure you're doing deep breathing of any variety. It can be just simple deep breathing, it can be a part of a meditation, it can be part of mindfulness, really getting on to the task of taking care of your body through any kind of breath work is a huge, huge, huge coping skill. It's also free. It's invisible. No, like because we all are breathing all the time, so no one notices if you're doing deep breathing. These are some apps that really offer some really nice guidance. Headspace, Insight Timer, and Calm. These are all wonderful apps. They all have free versions. They also all have paid versions. I've honestly, the free versions are usually more than enough for most people. YouTube is another resource I did not put on here, but if you just go on YouTube and you say deep breathing 5-minute video, there are thousands. Again, everyone has their different, preferences, and that's okay. But these are really nice because if you have a smartphone or if you have access to a computer or an iPad or something, a tablet, that these can be right there. They're super simple. They can send you reminders so that you don't even have to remember to do them. These are just really nice apps to go on. And again, gentle, usually fairly like okay for first time learners or even the more experienced people. Again, if I was to choose one out of all these, I would choose Headspace to recommend and Cozy as the app recommendation. All right, and then for more like practical needs, paperwork pieces, this is a workbook that I have recommended to my caregivers in the past, to families. I've never actually had someone use the entire book. We've more gone through certain chapters depending on what the individual person needs, what the patient might be going through for treatment at that time. Again, this is a pretty generalized caregiver workbook, so just kind of like heads up, there's some references to non-oncology, non-brain tumor caregiving roles. You're welcome to skip those, but this just has some paperwork, has some forms, just things to talk about and even like start conversations around. You can use it, cover to cover if you'd like, but you can also just look through the title page and say, what else might I want to think about? What else might I want help around? So again, it's a really nice resource. I find it pretty like easy to use, easy to read. Again, not an endorsement, but it's there. And then in terms of if anyone is in the phase of caring for a loved one who might need to start having advanced care conversations, I'm of the mindset, again, start early because you want to do it while you have time. You want to do it while people, have some sense of, I want to talk about this without having to actually go there all the way. 5wishes.com is a really nice document. It is generalized, but we use it often in the cancer center. There is also one for our younger adults, if anyone's taking care of a young adult right now, which I believe young adults are now considered 18 to 39. So there's voicing my choices for our younger population, but 5 Wishes does definitely apply to anyone of any age. And it's just, again, it's a conversation starter. In some states, this is actually a legal document. Depending on where you're listening from, it might not be a legal document in your state. But again, conversation starter can also be an advanced care document that you can have legalized. But again, that can be a different conversation. If I was to pick one, I would pick recommending the Caregiver's Toolbox. And then again, just more of this emotion-oriented, talking about management tips. One big piece, and I know I'm not going to go over this, these are like big, broad concepts that I'm not going to go over right now, which is okay. But just if you think these are interesting to you, I'll just kind of give you a lead of like where to seek out this kind of support. So retraining and reframing your thinking. This comes from the theory of cognitive behavioral therapy, the idea that when we address how we think, we can actually change how we're managing ourselves, how we feel physically, how we feel emotionally. And not that we're saying that what you're feeling needs to be changed or is bad, but it's just a way to think differently, especially if you're getting caught in excessive worrying, excessive reassurance seeking. Looking at what am I willing to keep, what am I willing to let go of, and then how can I be flexible and compassionate towards my loved one, but also how you treat yourself. Again, you will make mistakes, you will find success. I can say this day in, day out, but until you actually experience this and you actually seek this out, you need to experience it as a caregiver in your role right now. So if this is something that you're like, wow, it's super interesting, I would like to learn how to do this, this would be more of a support group and or therapist realm to kind of seek out support around. Again, there's lots of resources online. There's stuff in the resource pages I've attached to the slides. But again, happy to answer questions about that. The third bullet point, be accepting of your emotions. This is a big piece, again, talking about Guilt, sometimes shame for some caregivers is, why do I feel this way? Why do I feel so angry? Why am I so irritable all the time? Accept the fact that with caregiving, the caregiving role, there's so much going on at any given time that you're going to be overloaded, you're going to be overwhelmed, you're going to spill over your cup. And with that comes emotions that don't feel good. And so these are the ones I put up here are just to normalize what we hear from a lot of caregivers. These are obviously more of the negative ones. People also experience positive qualities of like, wow, I feel good taking care of my loved one. This feels good to have this experience. And it can be mixed in all together with all of these emotions, but part of your role for self-care is accept that these are okay, accept that these are happening to you. Acceptance is really hard. This comes from a field of acceptance and commitment therapy. I have a workbook that I recommend in the slides that would be great to work with this if you find this as something that you might want to work on. And then last but not least, be willing to let go of control. For those of you who are already caregivers, this is a little bit of a baptism by fire skill where you were kind of thrust into the throes of this is such an out of control situation. I need to learn how to let go of my control. One piece is don't try to be the fixer. You don't need to fix everything. You can offer support when asked. You can also discuss what your loved one might want for support, going back to what their action-oriented needs are. But you don't have to offer if it's not asked for. You can be the listening, you can be the witness. That's more than enough for many people. And then talking about listening, making sure that when you are listening, listen to understand, try not to listen to respond. A lot of caregivers, because they get caught up in this anxiety of let me do something for you, they're waiting to respond and they're so anxious, they're trying to get out. What's the next thing we can do? How can I fix this for you? If you feel that urge to pull into let me fix this for you, try your best just to sit there and listen and just see what the person's trying to say to you, see what your loved one's actually trying to communicate. Okay. All right, so again, like some books, just some recommendations for everyone here. I just mentioned acceptance and commitment therapy. That's what ACT stands for. This book is really nice if you do want to go into ACT. The Gifts of Imperfection by Brene Brown. For anyone who knows Dr. Brown, this is a really nice piece of how to help forgive yourself for your shortcomings or any mistakes that you feel like you might have made. And then in terms of mindfulness, going back to those 5 minutes of breathing, 5 minutes of mindfulness. How do I stay present in this moment? Not going too far into the future about what if and what if this happens, not going too far into the past of if only I had done. Mindfulness keeps you right here. This is an excellent workbook. For those who are interested, this is also available in Spanish. It used to come with a CD for those of us who remember CDs, but it now comes with a link to the resources online, mindfulness meditations. It comes with the book. So big recommendations. I believe that's the one. Yeah. So this is if I had one recommendation for you to follow, I would follow the mindfulness based stress reduction workbook. And then resource page, I'm just gonna let everyone like go through this themselves. These are books that we really love to give to everyone, our patients, our families, our caregivers. These are just, if you need just something else to read through, more perspectives to take, all these books are perspective taking or skill giving. Caregiver specific, I really like the Already Toast one. The other ones are really nice. The Stand By Me, actually, I believe it's not even released yet, but I have worked with Dr. Applebaum for many, many years. She is a caregiver expert. She is in New York City at the Memorial Sloan Kettering Hospital. Her book is coming out and it's incredibly, her work on this is incredibly thoughtful. Of course, any of these books are great. These are not endorsements. These are just books that I recommend that I have found to be very helpful in my own role taking care of people. And then for general perspective taking, these are all great books. If you want to take one book, When Things Fall Apart by Pema Chodron. She's an American Buddhist nun. It's a short read, but also a really nice read. Helps us understand when things are chaotic, what to do with them. And then Caregiver Handbooks, the ABTA, for those who know, has a wonderful handbook. So that's available. And then there's also the book I referred earlier, and then the General Wellness Workbook I just recommended. And then websites, I'm just going to leave this list up here. And Breen's going to send my slides out later, so you're all going to take a look. We have the resources, we have the links followed up, but just taking a look through all of this. I will just put a plug at the very bottom for self-compassion. Dr. Kristen Neff is the guru of self-compassion. She's a great website. Highly recommend you check that out as part of your Caregiver's Creed work. And then just to finish this up, a nice little quote: courage does not always roar. Sometimes it's the quiet voice at the end of the day whispering, I will try again tomorrow. Again, caregiving does not have to be a huge, loud role. It can be very small bits. It's really important. I hope you all give yourself credit for how hard this role is, and also the reward that comes with taking care of someone that you love and or care about. I will pause there.
Thank you so much, Dr. Clara, for that presentation. We do have time for questions. Just as a reminder, if you have a question that you'd like to ask, please submit it using the Q&A button on the bottom of your screen, and we will answer questions as time allows. So one of the first questions that we have here is for family and friends who aren't direct caregivers but want to help. What advice can you share for ways that they can support the family and the patient, especially for those people who may be afar, out of town or out of state?
Great question. My first thought is ask. And I think this is really hard because typically the person who is going through treatment or the primary caregiver, they are already exhausted, and it's really hard to answer the question of, well, let me know what I can do for you, right? So that's a really hard question to give to them. So for you, looking online, coming to talks like this, looking online of what else can I offer people? And across the board, you can definitely give people anything that you would want when you were not feeling well. So things like distraction, things like food. So for example, if anyone has heard like any of those, like the DoorDash, the Grubhubs of the world, if you can afford it, can you afford to give them a gift card? Something that helps the regular parts of their life to be easier. And again, making sure that don't expect a thank you, don't expect to hear back just because people can get so busy. So when you are offering support, make sure that you're giving it with a sense of complete altruism of, I'm giving this book to them, I'm giving them this gift card, I'm giving them, letting them know that I'm praying for them, for example, without needing to have anything come back to you, because sometimes they're going to be so overwhelmed that they won't even have time or even think about thanking everyone who's offering so much kindness to them. Most people do. I'm just saying this, just if you want to give, you can give things or you can give thoughts, you can send emails, you can send text messages, but just keep in mind that they may not be able to respond to you. Okay.
Thank you so much. That's really great practical advice that I think would be so helpful for the family and the patient as well. Early on in the talk, you talked about, adapting to your role as caregiver and adjusting. And we know with the brain tumor diagnosis, so much can change from the
Mhm.
point of newly diagnosed to when you're in treatment, when you're out of treatment or recovering, and so on. Can you share maybe some guidance or information on what caregivers can expect on how their role might change as you go through the brain tumor experience and how they can prepare for those changes?
Such a good question, and I'm tempted to walk on eggshells with this one only because there's so many different types of brain tumors, right? And so if we're talking about your role as a caregiver, it's going to depend on the brain tumor type, where the tumor showed up, the treatment that's being offered, the treatment that actually is able to be received by the person's body. So one part of this is the physical aspect. So how much you take care of their body is going to change for some people. For other people, the brain tumor just needs to be treated, and the individual really doesn't need physical care, but might need someone to check up on them relative to their cognitive functioning or even their emotional ability functioning. So say that a physical need is not there, but the person is having word retrieval problems, or they're saying like, I'm so much more quick to anger, help me like navigate that. Over time, it's really hard to it's hard to predict. It's a very open-ended question, but like it's hard to predict where you're going, but you can say, let me check in the physical aspect. Do they need physical help? Do they need cognitive help in terms of, is their memory okay? Is their speech okay? Is their word retrieval okay? Can they read? Can they do the things that they used to like to do? And then also emotionally, are they emotionally as supported as they need to be? And for a lot of people who've gone through brain tumor treatment, again, depends on the treatment, depends on the type, depends on the location. A lot of people struggle with irritability following treatment, and especially if there was any kind of tissue around the tumor that was also affected. People can really have changes of mood, changes of emotion, find themselves crying much more often or fearing the future. So really adapting to, how do I take care of them emotionally? That is usually what I see as the longest change that people have to learn how to adapt to, and that can be a tough one. learning what other caregivers do to take care of their loved ones, that's usually the best route to go about with this. But again, it's so independent of each individual. I hope that is a helpful answer.
Yeah, I think that was great. I think, there's some great takeaways there. It's being aware at each stage and where your patient
Mhm,
is at, and then getting that information, whether it's from the healthcare team or from other caregivers who've been in the same
mhm,
position. Another question we have here is for caregivers who have kind of been in this role for a long time, and are expecting to continue to be in this role for a long time. How can they manage burnout or ensure that they don't get burned out as they're supporting their loved one?
mhm. Yeah. Burnout is so common, and I like to say it's a quick burn, right? So a lot of people throw themselves into caregiving, and then if you're one of the situations where you caregive for a long time, sometimes for the rest of your life, my point being made about making sure that you're really attending to the other identities and the other roles that you have in your life is incredibly important. So it's not about throwing away or shrinking the caregiving role. It's more about growing the rest of you, and that will incorporate the caregiver role. But it's no longer going to be your core identity for most people because maybe you're a caregiver and a teacher and a community member and a bird watcher. So making sure that you're really attending to the other parts of yourself and the other parts of your identity that give back to who you are, that will help with burnout because typically burnout is because not that we're overloaded with things, but because things have become tedious or repetitive. Thanklessness comes into play with burnout in a sense of I keep giving and it's not going anywhere. So when you attend to other parts of yourself, usually we get back a little bit more, and that can really help with burnout.
Thank you so much for that wonderful advice. Another question we have here is when we think about the caregiver's well-being, can you talk a little bit about the role that regular exercise can play, like walking and things like that?
Yes. Um, I suspect this person might already suspect what the answer is going to be, but I'll say it anyway. So, a huge part of self-care, this is for anyone, but especially for caregiving, is that you have to take care of your own body. If your own body is not well, if your own body gets sick, then you can no longer likely be the caregiver that you want to be. So, standard good health, and that includes making sure that your cardiovascular health is up to bat in terms of going for walks. Again, meditation is a really important part of physical health that people always skip over. Making sure that you're hydrating, make sure that your diet is balanced, and making sure that you're eating and you're not having too much coffee. Parts of that, making sure that you are living to the standard well-being of health. And if you have questions about that, go to your PCP and say, listen, I have been putting all of my energy into this one person. I need to turn towards me. Can you and I talk about what am I doing with my health? How's my health? How's my cholesterol? How's my blood pressure? And again, the idea is that to give to yourself will eventually give back to your loved one, but you need to make sure that you're doing, again, consistency, making sure that your body's taken care of through exercise, hydration, diet, meditation, depending on what you have, time for. And I also like to just remind people that when I say exercise, when anyone says exercise in a medical sense, it doesn't have to be walks, it doesn't have to be runs, it doesn't have to be like a cycle class. It can be dancing, it can be going to play pickleball, it can be something that moves your body and escalates your heart rate or just gets your joints moving so that you're not always on the couch or always in the car or always at the office desk. Get your body up and moving, and a body in motion is a healthy body.
Thank you so much. And I love that advice of, it can be fun things too and things that you
Mm,
enjoy. I think we immediately think of having to go to the gym and it becomes this
right.
big chore. So that's a great way to just incorporate it into your day to day.
Mhm,
Another question we have here is for those caregivers who may need outside care for their patient, to
mhm,
help with physical aspects or other deficits that the patient is experiencing, maybe home health care, respite care. Can you provide any advice on how to navigate that, how to find those type of care and support and where to turn to?
mhm. I will say this is not my big area of expertise, typically just because with the team that I work with, a lot are oncology social workers. So every group has a social worker, and they will help navigate this part of it. We also have wonderful palliative care clinicians who work on my team, and they also have more of these conversations around the visiting nurse, like when to get the visiting nurse, when to have someone who can come in for respite care. The tricky thing about respite care is it's it's location dependent, sometimes it's insurance dependent, and sometimes it's accessibility dependent. So sometimes there are not people available in the area where you live. So I would start with a social worker if there's a social worker on the team. And then if they're like, I'm really not sure, then you can honestly, like I've done this before, you can Google local respite care options. On all their websites, they're usually very compassionate and kind. They'll kind of lay out like when and what you might need in terms of a respite care option. If you ever have questions, they usually have like a phone number for each of these respite care places. Give them a call. Asking questions, gathering information, talking about the action-oriented tasks that you can accomplish. This can be one thing. Respite care is unfortunately like it's different everywhere you go. So I don't have a great answer for that. But lean on your team, the clinical team. It's not their first rodeo. Ask them for help. Ask them for support.
Thank you so much for that advice on where to turn to. I will also share for people who do have questions about specific care in your area, I'd encourage you to contact the ABTA Care Line. You can call at 1-800-886-2282, and we'll include the information post-webinar too. We'd be happy to talk to you more about what you're going through specifically and resources that would be more appropriate for your specific situation.
Mhm.
Another question we have here is about expectations. So, as caregivers, we may have expectations on where we expect our loved one to be and how they're doing. Sometimes they may be unrealistic. How can caregivers manage those expectations to really help them cope with that emotional impact that those expectations and not seeing those expectations come to fruition may
Mhm.
have on them and their mental well-being?
Mhm. This is so tough because my answer is gonna be, you're gonna need to sit in those feelings and experience them because expectations are an incredibly normal part of being a person, right? We set goals, we set expectations, we wanna meet those, and then when they fall down, we get disappointed. It's not a bad thing to be doing this. For most of us, we're not really setting, like, completely high, out of this world expectations, but it can be, I would like this person to be off treatment by July, and then we can go on a vacation in August. And that doesn't happen for various reasons, and the expectation becomes disappointed. The idea is that sit with the feelings for a while and really have some of that important self-reflection work. And again, this can be on your own, 10 minutes a day, sitting and saying, how do I feel about the situation at hand right now? Or it can be accessing through a therapist or through a support group. And I know with that being said, I just do want to validate that it's really hard to find a therapist and a support group nowadays. After the pandemic, I think we've all struggled to find or like really see how the mental health community has been able to offer services. I just don't want anyone to get discouraged. If you're struggling with unmet expectations and it's really getting in the way of your day, please seek help. You can go to your PCP, ask for them to help you match up with someone. It's okay to ask for that, but it's an incredibly normal part of this. So if someone's sitting with the disappointment and saying, this is really hard for me, this is really disappointing. That's where mindfulness, that's where acceptance and commitment come in and can be a helpful skill to have. It's really tough though, because just because you've gotten past that time point once does not mean that you're done feeling uncomfortable feelings about it.
Thank you so much, Dr. Clara, for all of your wonderful answers and thoughtful answers to these questions. Unfortunately, that is all the time that we have for today. Again, I want to thank you for your wonderful presentation and for all of your answers. If you did have any questions that weren't answered or you're looking for additional support, I encourage you to stay in touch with the ABTA. Contact the ABTA Care Line by calling 1-800-886-2282 or emailing us at info@abta.org. I also want to thank today's webinar sponsor, Genentech, for their support of this program, and a special thank you to each and every one of you for joining us online today and sharing your questions. We hope that you found this webinar to be beneficial and informative. We encourage you to take a few minutes to complete our webinar survey, either by scanning the QR code on your smartphone that's on the screen or going to the link there. Your feedback is important to us as we plan for future programs. You will also receive a link to complete the survey along with the webinar recording, resources, and a copy of the presentation in an email message in the next few days. If you're looking for more information, support, programs, events, and services, please visit the ABTA's website at abta.org, email us at info@abta.org, or call the ABTA Care Line at 1-800-886-2282. This now concludes our webinar. Thank you so much for joining us and enjoy the rest of your day. You may now disconnect.